Hi guys, it's Holly here at Faces. Welcome back to the Face It podcast. Today I'm with the gorgeous Fizah from the Pharma Clinic. Thank you so much for joining me on the podcast today, lovely. Really appreciate you coming on.
Having me.
You're more than welcome. So, just to kick things off, then, do you want to just give us a little bit of insight into your background? Because you are a prescribing pharmacist by
Yeah,
background, aren't you? And you're now into the aesthetics field. So, do you want to just give us a little bit of insight into your journey and how you got to where you are today?
yeah, absolutely. So, as you said, I'm a prescribing pharmacist, and I started off my journey actually in the NHS. So, I started off working in a normal public sector hospital. I then moved actually into the private sector of the medical field. I
Yeah.
worked there for about 2 years, and that was my first sort of exposure to the aesthetics world, but it was more through cosmetic surgery because the hospital that I used to work in did cosmetic surgery, and I used to every
Um,
pharmacist had a sector that they looked after,
yeah.
and cosmetic surgery was the area that I found the most interesting.
Yeah.
That was my first sort of insight into aesthetic treatments, and then I decided that I did want to train in aesthetics from there, and slowly, I don't know how, but I've ended up over here where I am fully into the field now. I just feel like once you take the initial step to go down the route,
Yeah.
doors open, you
Yeah.
network, you meet
Yeah.
different people, and then before you know it, you're an aesthetics practitioner in the field. So that's
Yeah.
pretty much how I got here.
Amazing. So obviously it was kind of a blessing, wasn't it, that you were able to work in the cosmetic side. So had you thought about aesthetics prior to that or not really?
I
Was
I've got a bit of a sort of conflicting background. So I've always really been into the beauty industry just as like a personal passion. But in terms of career, I've always wanted to go into healthcare. And there always seemed to be a gap in the between that I
yeah,
wanted to bridge. I always wanted to stay in healthcare, but my passion always lay in the beauty industry. And this was the one area that I found that I could actually bridge both of my passions and really make it work. So
yeah.
I think it's quite a unique mix of things that I've got going on.
But I've spoken to other pharmacists or other prescribing pharmacists who are doing aesthetics full time, absolutely love it. And I think use so many of your skills as a pharmacist within this industry,
Definitely.
especially with obviously the prescribing side of things when it comes to your toxins, vitamins, whatever it might be that you need to prescribe,
Yeah.
but also like the consultation process. Obviously when you're working in a pharmacy, you don't know what's going to come through the door. It could be you don't know what
Exactly.
day you're going to have, and that's the same with clients. You might get
100%.
you might get a client booking for lip filler, and actually in their consultation, you decide on something totally different.
Yeah,
Um,
yeah.
so I think a
Right.
pharmacy background is like a really great one to have within this industry,
I think
definitely.
like you said, transferable skills. I feel like a lot of skills actually as pharmacists that you just pick up on your day to day, you can actually apply most of them to an aesthetics clinic as well. It's
Yeah.
just in a different format. But like you said, the job actually in itself is quite similar in that sense.
Yeah, and I think it's nice then because you obviously love the healthcare side of things. You wanted to keep working within that. So it's nice that you get to still use all of those skills that you've learned and your qualifications to do what you're doing now. So
Yeah.
have you completely left the cosmetic surgery side of things, and you're just running your own business now?
I do still work in primary healthcare, so I work in a GP surgery as well, alongside my aesthetics, and it's just to keep a toe in the water, if
Yeah,
you want to say,
yeah,
just
yeah,
to keep my clinical knowledge up to scratch,
yeah.
and just have basically a finger in that pie as well. So
Yeah.
I do that alongside my aesthetics as well.
Yeah, I think that's like you say, it's great to have that because it'll keep you up to date with everything. Everything changes constantly, doesn't it? Regardless
Great.
of whether it's in healthcare or not.
Yeah.
So I think it's nice that you can do both. So with regards to building your client base, then that's normally the thing that most people struggle with the most. Um,
100%.
how did you find that side of things when you first started your aesthetics, and what's worked for you in terms of getting clients through the door?
I think the first barrier that I hit was, and this is just some advice from someone who was a beginner at one point, really do your research into who you're training with, because the company that I ended up going for, they didn't actually let you take any pictures for your portfolio. So although
Why did they
yeah,
do that?
they said it was and by the way, we only found out on the day as well. So we'd all booked it, paid for it, turned up. No pictures were allowed. They said it was for GDPR reasons. So what happened is I was qualified as an aesthetics practitioner. I had absolutely no photos to show my work that I had done during my course. So as you can imagine, when I went to go and book clients after that, even if it was just models, it was very difficult for me to get any models because they had no pictures from my portfolio for me
Yeah,
to
of
show.
course. Yeah.
So that was probably the thing that slowed me down the most in my progress at the beginning. So just to anyone out there that is watching this and they want to come into the aesthetic sector, really research and ask questions before you go onto courses. Um, I'd say that honestly, I have a very supportive family. My sister, my fiance, my aunties, anyone that I could get in to do a treatment on, and they would let me do a before and after photo. That is how I started. That's how I had to start my portfolio. And I think it's the case for a lot of aesthetic practitioners. It's
Yeah.
friends and family first. And to be honest, after that, it's been word of mouth. I have pushed myself on social media, but the biggest thing for me has been word of mouth. I think once someone experiences your work and the way that you hold a consultation and how you operate as a practitioner, I think once someone is happy with how they've been treated and what they've had done, they will pass that information on to their
Yeah.
loved ones.
Yeah, 100%. And they're a walking advertisement, particularly with dermal filler treatments,
Yeah,
and lips, those are quite obvious treatments. I think when somebody has a great experience and they look amazing, people are going to ask, who did them and
yeah,
where did you go? I want to go. Do
yeah.
you find that clients are reassured with the fact that you are a prescribing pharmacist and with your healthcare background?
Yes, definitely, because I feel like the way I think I approach treatments is probably a little bit different to other aesthetic practitioners. Before I do anything, you book in for a consultation with me, whether it's on FaceTime or it's face to face, you sit down with me and it's anywhere between 15 minutes to half an hour, and I'll go through that patient and I'll see what their concerns are, what do they want to target, do a full thorough consultation, and then I'll come through and say, look, I think these are the treatments that, I'd recommend for you to have. And it's almost more of a medical way of treating the patient
Yeah.
rather than a beauty
Yeah.
appointment. Does
Yeah,
that
yeah,
make
yeah.
sense?
Yeah, yeah, yeah.
You
Absolutely.
book eyebrows done. I don't do it like that. I do it like you booking a consultation and then we'll figure out what you'd like to have done and take it from there. So I think that the way that I sort of conduct the consultations as well, it really reassures a lot of my clients.
Yeah, because I think that that's something that which I like to ask, particularly people with a background like yours, because I speak to some pharmacists are like, do you know what? It's not something I really promote, and I'm like, you should do. You should like take pride in the fact you're a
Yeah,
pharmacist. Like, a lot of clients, particularly with what you're seeing in social media right now, like obviously there's all sorts you're seeing. I think it can be reassuring for that client to know that you have a prescribing background and a healthcare
yeah,
background, particularly
absolutely.
when it comes to like, filler dissolving, that kind of thing as well.
Yeah,
Yeah.
you want to know you're in safe hands. I think another thing that a lot of my clients like, just as a general benefit as well, because of the background that I'm from, any complications, it's not going to be a long-winded process for me to handle. A very common one that happens is after dermal fillers, people getting cold sores. I can write a private prescription and they can go to their pharmacy and get it straight
Straight
away.
away. Yeah.
Like they
Yeah.
don't have to wait for me to get in touch with someone. They don't have to go to their GP surgery. They don't really have to do anything. They just need to drop me a text with a picture. And before you know it, I've sorted them out with what they need. It's just a very easy, streamlined way
Yeah.
of doing it. Yeah.
Yeah, that's so true. Yeah, and I think that makes it easier for you, makes it easier for your client, and obviously that extra reassurance as well. With regards to treatments, then, what treatments are you finding are really popular with your clients at the moment? And are there any treatments that you are looking to train in which you're not trained in at the moment as well?
Yeah, absolutely. So three things I would say are the most important at the minute, not important, most popular at the minute. Skin boosters. I think they've been in the market for a while, but I think they've picked the momentum up now. I think everyone wants skin boosters now.
Yeah,
Following on from that, under eye skin boosters. Again, I think they've picked the momentum up
yeah.
now slightly more than before. And the third one would be vitamin injections.
Okay.
So your B12, vitamin D, glutathione, vitamin C, those are quite popular. Not so much popular in the sense that I don't get people coming to me specifically requesting them, but after going through their symptoms and they go through with a vitamin injection course, the results are really good. So it's
Yeah,
becoming a popular treatment,
yeah.
I'd say.
Yeah,
Yeah,
I guess with your vitamins, that's something which you can sort of uncover just in either the consultation process or just
yeah,
conversation, when you're speaking to your client after the treatment, just getting
yeah,
onto that side of things. And I think, again, coming from a pharmacist, if you're saying to them, look, I think this would be beneficial for you, it gives you that kind of credibility and that trust as well. Um, like I wouldn't personally, if it was me as a client, I wouldn't feel like you're just trying to sell me that. I would feel like, okay, you've got the knowledge and the background to really know
yeah,
that that's something that you think will benefit my health. So I would
yeah, yeah,
say as well with the go back to being a pharmacist and your healthcare background, that will definitely make people trust you in that sense when you're talking about vitamins and that kind of thing, for sure.
yeah. I definitely think it comes with the profession, like you
Yeah,
said.
for sure.
Yeah.
Are there any treatments that you want to train in that you've not yet trained in?
Because with me, vitamin injections have become so popular. Not all of my clients, and I can understand this, they don't want to come every couple of months and get an injection. They find it painful. I have some needle phobic clients. They don't like the thought of a needle going in. I completely understand. So I want to do IV drips next as
Yeah.
my like build on from that because you can do multiple vitamins just in one go and it's a little bit less painful as well if you do it through an IV drip.
Yeah. Yeah.
Yeah.
Again, more of like a medical treatment as well, I would say.
Yeah.
Um, with regards to sort of where your business is headed then, so you've grown really quickly, which is amazing. What do you have any growth plans or plans for new premises or new staff or anything for the next sort of 12 months?
I think within the next 12 months, I want to make sure that I have my clinics regularly running. So the way that I do it at the minute is I'll do a clinic once a month and it's sometimes it's like once every fortnight and then I'll take the app and then there'll be one like 4 weeks later.
Yeah.
I do think with the amount of clients that I'm getting, the frequency is going to start becoming more. So I actually just went and looked at a clinic yesterday. I am looking for somewhere to be
Yeah.
able to um, start doing my clinics more regularly, but that's actually very difficult. I didn't realize how difficult it was to find like the right place to up.
Yeah,
So
it's finding the right place in terms of an aesthetic point of view. So something that looks like how you want your brand to be presented, but
yeah,
also then thinking about, if you are renting a space within a clinic, which is obviously another option, what kind of client base does that person have? Because I was
absolutely.
speaking to someone earlier and she said the first salon she worked in, it was the wrong client base for what she was looking for, wrong branding, just wrong area. Like it just didn't work. Whereas she's now moved to another one and you know, they just work well together. So there's so much more to consider than just finding the right clinic. It's like, okay, what kind of people live around here? What kind of treatments do I offer? Do they go hand in hand? You know, so many different things to consider, isn't it? Have you seen any that you like the look of as of yet?
A couple, there's two that I really like the look of, so we'll see what happens. The problem is, it's what you exactly said. When the one that I went to go and see yesterday, for example, when I went in, I could just tell from like the vibe and the area and the clients, they probably weren't looking for someone like me to be in there, which is perfectly fine. I just wasn't a good fit for that business. So hopefully, fingers crossed, I'll find the right place.
Fingers crossed. So with regards to the Faces app, obviously you've used Faces for quite some time and you're one of our prescribers, which is amazing. Do you want to just talk a little bit about how Faces has helped your business from a prescribing point of view, but also from your own client's point of view as well?
Yeah, absolutely. So in terms of from a prescribing point of view, I just think it's extremely easy to use. I think that's the reason why I've just used Faces app as like my main source of ordering and prescribing. You know, when I was doing all of my ordering sort of on my own through me and the supplier, if something goes out of stock, you're like, right, what do I do? Like you'll go to a different place, you know, ring them up, see if they've got it in. There's all sorts of different things you have to do. On Faces, it's so easy. It's like you're on ASOS, essentially.
Literally. It actually is. I always say it's like Amazon for aesthetics. Like it really is.
Yeah, that's exactly it. So you just literally type in, you know, Azalor, and it'll come up with everywhere that's got it in stock, who can get it to you the quickest, the delivery detail, everything just pops up. It's super easy. And all of your consultation forms as well. I find that side of it super easy as well. I really think it's the convenience factor and ease of use, which has just made everything so much easier for me. And also on the flip side of that, in terms of the prescribing, I'm actually allowed to offer my prescribing services to other practitioners as well, which is something I'll be completely honest with you, when I qualified as a prescriber, I didn't even know that is something that people would need. Only going through the Faces app, and then I started getting the requests. I was like, oh, people could actually use me as their prescriber. And that's a really nice side to it because it's more of like a community feel. I can offer knowledge, you know, I've given a lot of practitioners advice regarding you know, Botox dosing and things like that. And it's just a really nice way to be able to communicate with other practitioners as well.
Yeah, I think a lot of I mean, we've got hundreds of prescribers on Faces, but I think that's one of the things which people tend to like is that you're able to help other practitioners in the industry as well. And I think especially for someone who's a non-medic, you know, qualifying and then trying to find a prescriber is like, you know, you can't just go to your GP practice and be like, hi, I need some Botox for my client. That just doesn't work. So it just makes it easier for practitioner, whether you're medical or non-medic, to find a prescriber in your area or whatever. You can search by name. But then we try and make it as easy as possible for you as well. So you can see all the client's information, all the client's medical history, what products the practitioner needs, and obviously communicate with the practitioner as well through the app. So yeah, I'm really pleased it's working for you. And another little way to make some extra cash as well. You know, it's just some extra money. It's always good. Just with regards to regulation then, so obviously I would say someone like yourself who's a prescribing pharmacist is probably in like the optimum position with everything that's ongoing at the moment with regulation. Obviously nothing's been announced yet, but there's a lot of anxiety in the industry around it, which has been kind of populating social media. What are your thoughts on what has been announced and sort of the idea of regulation anyway?
I think it was going to happen, and I think it did need to happen as well. I think just in general, every industry has some form of regulatory body. You know, the beauty industry will have regulatory bodies. pharmacists have it, doctors have it. I just think it was about time. I understand the anxiety that comes alongside that, because people are probably thinking, well, what sort of rules are going to be implied? What does this mean for my practice in the future? From what I've gathered, and my prediction might be completely wrong, I don't think they're going to completely shut out non-medical practitioners. The only thing I think might happen is that you may need to train a little further. And although it's annoying, especially for, some practitioners I know that aren't medical, they've been in the industry for over 10, 15 years
Yeah,
now.
yeah,
It's a little bit of a slap in the face to ask them to do a further training course. But
yeah,
at the end of the day, it's for patient safety. And I think if we all think in that sense that it's all for patient safety, it's all for, it's the right thing to do, it's a good cause. And we've all heard the horror stories, we've all heard the bad side of it and how it can go really wrong.
yeah.
If it means that doing it the right way and in a regulated way means that that side of it will reduce, then I think everyone will be more than happy to comply with whatever regulations come into place. I think that's the main thing.
Yeah, definitely. And I think as well, having that structure and that kind of like that standard will be so helpful for not only client safety, but also for practitioners in the industry as well to kind of know, like, okay, I am doing what I'm meant to be doing. I do have the right things in place.
Yeah.
And I think any good practitioner who puts, sorry, go on, lovely, sorry, it just cut out.
I'm just going to say, it can be a lonely place,
Yeah,
aesthetic. If you're in, a situation, a consultation, and you're not 100% sure about something and you don't have someone to contact straight away, it can be a lonely place. It can be a bit of a scary and daunting place when you first start practicing as well. So I feel like you said, if a standard is set across the board and you know exactly what practices need to be followed,
yeah.
it's going to be a lot better for practitioners themselves as well.
Yeah, 100%. And hopefully, those practitioners who are doing everything correctly, because I know that there are many non-medical practitioners and medical practitioners who, like you say, do put client safety first, have built amazing businesses, are very talented. Hopefully for those people, it'll just be a case of like, yeah, I'm doing it all. So, come and give me a license. And that I know it's not going to be as easy as that, but for those who care and who put their client's safety first, it should not really affect how they
How
are.
they're working. Yeah,
Yeah,
I
exactly. The only thing
absolutely.
is obviously the whether certain treatments obviously they can't do. But fingers crossed we don't get to that, but we'll just have to
Yeah,
see.
I'm
Um,
I'm trying to be an optimist at this point, and I'm just hoping that that doesn't come into play. Because I do think, and this is just coming from my own personal opinion, I do think it's a little bit unfair, especially when some of these practitioners have been in the industry for that long and they've proven they can safely do these procedures. It's not fair to take that away from them.
yeah, absolutely. We'll just have to see. But just to finish on a positive note, can you pinpoint any time within your aesthetics career? So obviously since you started doing your aesthetics treatments, where you think I'm so proud of like what I'm doing, like I love what I'm doing, whether it's like a certain client that you've seen or like a certain memory that you've got from training or whatever, is there like it's something that sticks out to you?
I think so. I'm based in Greater Manchester, but I have some friends down in London, and they wanted me to do some treatments for them. So I went down to London and I did one clinic as a one-off in London. And I go down to London probably every 5 weeks, I'd say, and I manage to do a clinic there. And my I don't have loads of clients. It's only about 6 or 7 clients that I have that I go and see, and the progress that I've seen with these clients and sort of the little growth that I've seen down in London, it's a really surreal moment for me because it's completely out of where my local area is. I'm going out of my way, but I am actually being able to hold a clinic down there. So I think that's a really nice bit of progress that I've made.
Yeah,
And you move from from like just one location to two and you see that growth, I
Yeah.
think that's a really big thing.
Particularly going to London, there's so many practitioners. I mean, there's so many practitioners everywhere, but particularly London, that,
Yeah,
there's clients that
exactly.
are choosing not to go with someone who's like local all the time. They're choosing to go with yourself. I think that's
Yeah,
amazing.
yeah,
Um,
exactly. And they'll wait as well. And I think that that's so nice that they'll wait until,
yeah,
I'm next in London. They might have to wait 2 to 3 weeks for me to be able to slot myself in there, but
yeah,
they'll actually let me get down and do their treatments, which is actually a really, really nice thing.
amazing. Well,
Yeah.
lovely. I'm so happy that we got to speak, and congratulations on everything you've achieved so far.
So
Cannot
much.
wait to catch up with you in the next 6 months to see where you're up to and where your
Yeah.
growth is.
Yeah.
Yeah, honestly, thank you so much for coming on the podcast. Really, really appreciate it.
Thank you so much for having me. And hopefully in 6 months, I'll have that clinic.
You will, you will. I'm manifesting it for you. I'm going to follow you, and I'll make sure that, you do. I'm sure you will. Absolutely.
Thank you so much.
Amazing. All right, lovely. I'll speak to you soon.